I think that we will go ahead and get started. Hello, everyone, and welcome to this series of webinars that we're offering through the Steps to Health program, which is NC State's SNAP-Ed program, and Faithful Families Thriving Communities. It's a series of 3 webinars on the impacts of COVID-19 on food security, physical activity, and health. So today's webinar will feature the research of Dr. Lindsey Haynes-Maslow, who is an associate professor and extension specialist in the Department of Agricultural and Human Sciences. Lindsey is also the PI of the Steps to Health program and has a wealth of expertise and has led many studies around food insecurity and health, and also health policy. So we're really excited to have Lindsey with us today to offer insights about a research study that she's recently completed. As I think a lot of you know, this is a series, and so for the next 2 Mondays following this one, we'll have webinars that will focus on what practitioners and faith communities and community organizations can do to address some of what you're going to hear about from Lindsey's presentation today on how COVID-19 is impacting food insecurity and physical activity. And so in the following 2 webinars, we'll be addressing from a community perspective, what are some ways that communities are stepping up and can address physical activity and food insecurity needs during this time. So we encourage you, if you haven't signed up for those, to sign up for them as well. All of these will be recorded and posted on the Faithful Families website, so we can send that out via our social media and newsletters once they are up on our website. So once again, Dr. Lindsey Haynes-Maslow is with us to talk about exploring the impact of COVID-19 on food security and health in North Carolina. And I will turn it over to Lindsey to carry us through her presentation. So thanks for being with us.
Thank you so much, Annie. I was going to say thank you, everybody, for taking the time on a Monday to listen to our preliminary results. I will say first off, this study could not have been done without the help of many of you on this call. We had sent out information several months ago asking for folks to send this to different individuals, and we were really trying to get a sense of how COVID-19 was really impacting North Carolinians' health, especially as it related to food security, physical health, and mental health, and then also really trying to figure out how we could build a responsive public health system during a crisis. Now, I do want to really reiterate that these are preliminary results. So we had a survey that we distributed through multiple listservs across the entire state. And the survey was live, so anybody could take the survey between May 5th and June 12th, 2020. And again, these are really just intended to start a conversation amongst our webinar participants, and also in addition to our following webinars, webinar 2 and 3, about really what we can do about food security and health behaviors in North Carolina. So while I'm going to show a lot of information and data today, just recognize that no statistical significance has been calculated. These are really just preliminary results, and we'll be interested to see what this looks like when we start doing more advanced analysis. But just in general, I want to give you an overview of who actually took this survey. When you send these things out over listservs and emails, you have no idea what the response you will get is. But we actually had 407 individuals across the state complete the survey. And we had a fairly good geographic range. I will say our heaviest was probably in the central part of North Carolina, and then up through the coastal plains. And you can also see up in northeastern North Carolina. We had the least amount of representation out in the west. And I don't know if that's due to internet access issues or just in terms of, the lack of density and population, but we did ask folks to enter their zip code. So for each dot that you see, that represents a zip code that was entered. So while you see one dot where a zip code is, there might be 10 people from that zip code who reported. So we did get fairly good statewide representation besides the mountains, which again, we need to figure out how to make sure that we can reach those who may not be accessing our information. But also, just to break it down, we also had pretty good diversity. Almost 60% of our respondents were white or Caucasian. We had nearly 30% African American or Black. 4% reported that they were Hispanic or Latinx, and we had other individuals had very small numbers of American Indian or Alaskan Native, and not very high representation for Native Hawaiian or Pacific Islander. But this also, besides the lower Latinx population response, this does fairly mirror our state's demographics in terms of race and ethnicity. Now, level of education, we did, with sending the survey out, we did have more than half of our participants had completed a 4-year college degree or higher. The rest, you can see, either completed a 2-year junior or community college degree. Some people had gone to college but did not receive a degree, and some people received a high school degree, but nothing beyond that. And we had a small amount of individuals that had less than a high school degree or less than a high school equivalent of the GED. In terms of gender, you can see overwhelmingly we had over 80% of respondents were female, and only about 16% were male. We had a very small sample that chose to identify as a different, they basically preferred not to answer the gender questions. In terms of marital status, again, we saw overwhelmingly half of our respondents were married, and then the rest of the group, we had the second highest category was single or never married or not living with a partner. And then also widowed, divorced, or separated, that was about 15% of our respondents. Now, household income, I know these numbers might be really hard to see, so I will read them out to you. I will just say that the largest group in our survey was those that selected that they made more than $50,000 per year. So that averages out about to $4,100 a month. However, it is important to recognize that this is just what people reported in terms of household income. So in order to calculate what percentage of our participants are actually living at or below the federal poverty level, we need to account for family size, which we did ask individuals how many children and or adults they had living in the household at the time. So we can do that during our more formal analysis. Also, we asked about household services received 3 months before or during COVID-19. And in terms of this, the largest number of respondents reported that they were receiving free or reduced price school meals, such as school lunch or breakfast. And then following that was SNAP, or also known as food stamps, as well as the WIC program, the Special Supplemental Nutrition Assistance Program. And we also had, we gave individuals also options to state whether or not they were receiving informal support. So individuals had some response that they received food as gifts from relatives or friends, also relying on food from alternative sources, such as gardening or doing their own harvesting and, harvesting wild food. And then there were several individuals that were part of a CSA. We see the smallest group that was selected was the after school or summer meals program, and that is has been a fairly underutilized program. So that's not anything to strike out or be worried about right now considerably. Again, it was underutilized before COVID. I think with some of the newer COVID flexibilities with food distribution programs, that number has probably changed since when we asked about it. Now, I do want to go into our food security data. So we wanted to really focus on the status of food security and how had COVID-19 impacted it. So we do want to, just before we go into food security, how is this defined and what definition are we using? So the USDA, so the US Department of Agriculture, defines food insecurity as the limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in a socially acceptable way. And here is a picture of North Carolina, and it's divided into our congressional districts. And this is just a quick snapshot in time, and it was from 2017 of child food security rates by congressional district. Again, I know the numbers are small, but I do want to highlight that the greatest areas of child food insecurity rates are in this region number 1, so congressional district number 1, which has almost a 25% food insecurity rate for children. And so that means almost 1 in 4 children are food insecure in that district. The second largest area is congressional district number 4, and that's following very quickly, or actually the highest is number 4, which is where you find the triangle area. But again, these are our levels of child food insecurity from 2 years ago, 3 years ago. So what we did in terms of food security, we asked individuals to respond to 6 questions, and these questions come from the USDA. It's a food security screener, so people can answer these questions as often true, sometimes true, never true. They can also choose to not respond, but this 6-item screener has been a validated scale, and it's used in many, many studies. So what we wanted to look at is, you can see we asked them before COVID-19, how would they respond to this question? And then during COVID-19, how would they respond to this question? And I have highlighted in red some of the areas that had the greatest changes between before and during. And that first area is actually on that question, which is the food that my household bought just didn't last, or it wasn't enough food and we didn't have money to get more. So before COVID, that was often true for only 1.8% of our participants. During COVID, that number jumped to 7%. So again, I know that we don't have statistical significance, so we don't know if that is a huge increase, if it's a statistically significant increase, but it is an increase that I would say is cause for some, concern, and also trying to pay attention to. I will say the next area that we truly wanted to focus on was the never true category. So you can see on that third line, the question is, did you or others in your household ever cut the size of your meals or skip meals because there wasn't enough money for food? So before COVID, we had 86% of participants saying that never happened. It was never true. And then after COVID, we had about 79% of individuals saying that was never true. So that means people are starting to feel more food insecure. Again, we have to actually calculate the scales in terms of whether we would put people in a category of, are they truly food insecure, or are they on the edge of it or the border of it? But what is I will say not alarming, but it is, again, an area to watch out for, is you see that the often truths before and after, all of those numbers are increasing. So people are having trouble being able to afford a balanced meal. They're having issues with eating less food because they didn't think there was enough money for food. They're having issues with feeling hungry because they just didn't eat and there wasn't enough money for food. And then also we asked people about how often they would say they were worried or stressed about having enough money to buy nutritious meals. Again, the numbers that are fluctuating in a direction that would show us that people are becoming closer to that food insecurity status. And then I will say, if you have any questions, you're more than welcome to put them in the chat box, and we will save enough time at the end to go over a few questions and have a discussion. So the other question we wanted to ask is how you supported others in your community in any of the following ways since the start of COVID-19 pandemic. Through research that I've done and Dr. Annie Harderson-Moody, we've really recognized that a lot of individuals truly have these informal support systems, so relying on friends or family or truly the community. So when we asked this question, we were really curious what people would respond and what people were actually doing, even though that they were suffering themselves during a pandemic. We found that there was almost 180 people that basically said they picked up and delivered groceries or essential items to other family members or friends. We're seeing that people are still donating food to family and friends. They're donating money to family and friends. And we also see a strong sense of donating money to local businesses or organizations, and then also helping out with childcare because people are having to work and also take care of their children. And people are still donating food to a food bank. So I think that's something really resilient and about North Carolina in general, and the fact that even though people are possibly struggling and dealing with issues, they were willing to still help others and give what they could. We did have about 60 individuals say that they did not prefer to answer this question. Now, we also asked, since early March, were all foods you needed available when you shopped? I am sure that none of you are shocked that the overwhelming majority said no, not all the foods they needed were available when they shopped. And only a little bit over 50 people said that the answer was yes. And we followed up this question by asking what foods were actually missing or what were they not available. And so this is what we call a word cloud. So we took basically everybody's open-ended response. They could type in what they said was missing at the store, and we counted up the frequencies of how many times a food or beverage product was mentioned. And as you can see, meat, rice, bread, flour, milk were the #1 items that people were concerned about and that they were not available in stores. And meat, I will say, it was the most predominant item that was named in terms of when asking about what was not available in the store. We also asked people what would be the types of resources that would be most helpful for them and their loved ones during this time. And I've highlighted, again, some of the most, and we allowed people to select as many as they wanted. So this, if you're trying to sum up the percents, they're not going to add up to 100% just because people could select more than one choice. But one thing that stood out is the question of people were really wanting a centralized place of information about food availability in their areas. There's been definitely a lot of websites and apps and online platforms to try to help people find food in their area, but that was something that people were still seeking and looking for back in May and June. Other really high areas that people were interested in was food safety advice during COVID-19. Again, that was almost 9.9% of our respondents, or 108 people. And advice on home gardening, that was another big thing. I think people started to realize, like most of us, that we might be home for a while. And there were a lot of individuals that were getting interested in gardening and how to garden and what types of ways they can garden. But again, I'd like to highlight some positives in this resource list, in that, again, while people are trying to focus and they're trying to live their lives during a pandemic, another high area that people were interested in was advice on how to support their local food producers and their local food businesses, which again is very in line with that slide I went over previously about people really wanting to help and donate to local businesses. So this is really it's a revelation that, again, we really want to support the community even when we as a community are struggling. We also asked a few questions about health behavior, and I'll go over a few of them. And I will say that most of the health behavior data we received, we asked for a response to a question, and then we gave people the opportunity to write in direct quotes. And so I am always a fan of sharing the fact that I think other people are better at telling their story than I am. So the next few slides are going to go through some of those health behavior data points and what people have said about them. So the first question we were very curious about was what people thought about their work environment. Did they think it was safe? And if it wasn't safe, what did they think should be done to improve it? So approximately 20% of participants did respond that their employer had not or someone had not made the workplace environment safer. And then 30% preferred not to answer the question or they did not know. For those that said they felt like their workplace could have been safer, these were some of the examples they gave. They wanted their workplace or their employer to require masks. And again, remember, this is taken in May and June, so we did not have a mask mandate executive order in place at the time of this survey. We also had a lot of individuals asking for temperature checks of employees daily. There was a dire need for gloves and personal protective equipment, such as hand sanitizer and additional cleaning products. There was also a big sense of limiting contact with clients and customers for those frontline workers or people that may be the first person you encounter when you go into a store or a healthcare facility. And people were asking for safeguards for these workers, such as plexiglass or wall barriers, anything to limit their contact. People were also requesting back in May and June that we limit the number of staff at work. So they needed more physical distancing. They wanted more physical distancing. There were also a lot of comments and questions about, they don't know how offices are being cleaned, but they think they should be cleaned better. They were unsure of how the employers were sanitizing office spaces. So there was a lot of questions about that. So that was something that they wanted to ensure. And again, back in the early summer, people were asking to be able to work from home. And one thing that was also very clear was that people wanted to have some way or possibility to enforce these safety measures. So even if these measures were put in place, they wanted to make sure that people and other staff at their organization would have to comply with them and they would be held accountable for that. Now, the impacts of COVID-19 on physical activity is a little bit more nuanced. We actually had 56% of participants say that COVID-19 had made it a lot or a little more challenging than usual to get the same amount of physical activity. Obviously, the more challenging aspects were the fact that gyms were closed. And one person specifically said that they swam daily to reduce arthritic pain and the pool has been closed. So again, I will say gyms and pools were a big point of reason for why this was more challenging. Another issue, and this came up multiple times, was that people did not have exercise equipment at home. They were used to going to their gym, or they never owned equipment to begin with, or they couldn't afford equipment. There was also, we saw a lot that people were having to play the parent and also the teacher at the same time. So having to play a parent who was working, so the additional workload while spending more time caring for children at home just made people really they were too tired to be more physically active. We had one person who said that they ran a food pantry and they started working around the clock 7 days a week and they were just exhausted and they couldn't get motivated to be physically active when they tried. So those were just really the biggest issues that came up when it came to physical activity. Again, facilities are closed, additional work having to be done, and then just feeling so tired that they weren't motivated enough to get up and move a little bit. Now, on the flip side, it's the less challenging. Some people found that they were actually able to be more physically active during this time. One, because they had more time at home. This more time at home so that one person said a little more free time to use my home treadmill, my weights. So people were able to, have more maybe flexible work schedules so they could take breaks in between and start getting active. There was a definite theme about people who were walking around in neighborhoods. And I found that it was interesting that a lot of times when people talked about walking around the neighborhood or the community, most often they would mention if they lived in a rural or urban area. And North Carolina as a state, even though we do have lots of cities and metropolitan areas, we are still a predominantly rural state. So I think there was some sense of feeling safe in rural areas and being able to walk around and not having a lot of people out when they're walking. Again, walking around neighborhoods was huge. People just mentioned also they were running, they were hiking, they were gardening. They just had a little bit more freedom to try out different activities. Now, the impact of COVID-19 on relationships, we had asked a two-part question, and the first part asked about family, but I wanted to include this question, which was asking about family, friends, and coworkers. So we were asking participants if COVID-19 had made it, how it impacted relationships with family, friends, or coworkers. And nearly 75% of participants reported that COVID-19 had made it a lot or a little more challenging than usual to maintain healthy relationships. For those saying more challenging, someone said, not traveling to see friends, social events were canceled, obviously the restaurant closures, and concerns about spreading the virus to family and friends kept people at home. Also, there was just the recognition that giving support on phone and Zoom is not as effective as in person. But it was better than nothing. So something is better than nothing, but that lack of in-person communication or in-person contact was really difficult for individuals. And as someone even put in their response, not being able to see people in real life or hug them is so hard. And another person wrote, because of my employment and the number of people I encounter in a day, I would hate to infect my loved ones, even if I did not know I had COVID-19. And I will say that it seemed to be like we had, I can't remember the number of individuals that identified themselves as healthcare workers, but that sense of I am working in a clinic or a healthcare clinic and I just don't want to impact my family was a really, really strong theme among healthcare workers, as well as individuals just in their normal lives had to be in contact with a lot of people for other reasons. Less challenging, it seemed like some people were still seeing family and friends, but they were practicing social distancing. Because I thought I needed to inject a little bit of interesting comments. This one made me smile, but someone said people get on my nerves to start with. So I've been social distancing long before COVID-19. So some people who may not need that social interaction have had less issues when it comes to relationships. And then also some people actually found that it was easier to keep in contact with family and friends via computer and the phone, and with some social distancing in the neighborhood. And with that family and friends theme, you also found that people were able to reconnect with friends or family. And I think that's probably because they're using, email more, they're using Facebook more, or social media, or different platforms to reach out to folks that they haven't talked to in a while. Now, this will also be maybe a little bit hard to read, so I'll kind of show you exactly what these colors and what all this crazy charts mean. But essentially, we wanted to ask people about their essentially psychological distress. So like the USDA's 6-item screener, which is validated, we had used 6 questions that make up the Kessler psychological distress scale. And this is a validated measure. It's been used widely, and it's used as a screener for mental health problems, and also as a measure of the severity of the impact of mental health problems. And you basically ask how often someone feels nervous, how often do they feel hopeless, how often do they feel restless or fidgety, how often do they feel so sad that nothing could ever cheer them up? And did they ever feel that everything was an effort? And also they asked them, how often did they feel that they were worthless? Now, the important thing to watch on this graph is that none of the time is at the very, very bottom. So before the start of COVID-19, you see that most individuals were reporting that none of the time did they feel any of these things. They didn't feel nervous, they didn't feel hopeless, they didn't feel restless or fidgety, they weren't feeling sad, they didn't feel worthless. You had some people reporting a little of the time and then some of the time, but once you get to most of the time and all of the time, we had single-digit numbers. And again, these are single-digit numbers in a sample size of over 400. So again, if you kind of pretend to memorize this graph and this slide, you'll see what happens after COVID-19. So again, the very bottom is none of the time. The very top of this slide is all of the time. So then we ask the same questions. So now you start to see some movement across these scales. So where we predominantly saw that people were reporting none of the time they were feeling these things before COVID-19, since COVID-19, you're starting to see that people are saying that they're reporting they're feeling these things a little of the time, and you're starting to see greater numbers and some of the time. Most of the time you've got up into, the 40s, some of them are in the 30s, some of them are only 8, and then all of the time where before we only had single-digit numbers for each specific category, you're actually starting to see double-digit numbers. So again, this is something that and others would really, really want to focus on, is this mental health aspect, is the fact that just like food security, we're going in the wrong direction. We're going towards something that could be, again, mental health issues coupled with worry about food and how do you cover things. That's not a great a situation to be in, especially for people that we care about and our community. So we also followed up and said, okay, so what are your sources of stress or anxiety during COVID-19? And again, these are direct quotes from respondents. And I chose quotes that, again, these were mentioned many, many times, but just in different ways. I think the most prolific one is the fact that people didn't know when this would end. This person wrote it best when they said, I'm more or less used to knowing when a hurricane will end and other parts of the US can send help. However, no one but God knows when this global pandemic will end. So again, just the uncertainty of what's going to happen, when will it happen, that just was really unnerving for people. There was also a high sense of worry and anxiety for people that were in high-risk groups. High-risk groups were either due to age or pre-existing conditions, or maybe because of the work they had to do. Again, because of the work they had to do, some people said that they were really nervous that the people that they loved the most would get infected, or they themselves would get infected. And this is also, I think, an issue that's concerning for me as someone who is trained in science and also has worked very closely within state and federal government. It's just there was an inability to trust news of the media and our own government. There was so much confusion. I will say there were a lot of comments of people saying they didn't know who to trust. Was it the scientist? Was it the government? Was it their local news show? Or was it the national news TV? So I think for those who do research or those who work on communicating with the public, we need to go back and we need to basically get the trust of our public, because right now they're confused and they're not really sure who to look to and who to go to for the facts. So this is something that I hope that as researchers and practitioners, we can focus on. And this quote, again, it kind of leads into the high risk group, but this one, as I read it, really, I think resonated with me, because the woman just said, as a senior, I feel expendable. And that was during a time when there were discussions across the country of whether or not to open the state, to not open to the state. Do we open the country? Do we do this? Do we do that? What do you put first? Is it safety or is it the economy? And that was clearly seen through some of these answers of people trying to figure out what they wanted to do and how they felt about it. But again, this is just something that we'll need to work on our side of the university and as researchers. And I hope if there's anybody from the media that we can just, again, focus on this as well. We also asked folks what policymakers could do to make it easier for people to be physically and mentally healthy during COVID-19. There were a lot of themes that came up, and they were mostly in the area of what I just talked about, more information or clear information. People, I can't say how many times I read the word honest. People said, just be honest with me. Even if it's a worst case scenario, please be honest. I want to know what's happening. I need clear directives. I need to know what I'm supposed to be doing. I want to listen. And there was also a very strong theme in access to healthcare. Some people suggested that we needed free access to mental health services at this time. There were several mentions for expanding Medicaid in our state. And people also talked about supplies and increased infrastructure. The internet, obviously, I'm sure some of you are in areas like I am in an area where sometimes my internet is not working at all, and that causes problems. But more accessible and faster internet access. This was definitely brought up multiple times in the context of one, students trying to learn, people trying to do their jobs, and also just trying to stay in contact with the entire world or the community. There was also an ask for just more sidewalks. And I think this is really because people are trying to be active and stay physically active. And again, being more physically active might help with mental health. So people are asking to build more sidewalks and also transportation services. We realize that not everybody owns their own car. We also realize that even if you own a car, that doesn't mean your car actually works. So having those reliable transportation services to go to places you need was very important. And then people also mentioned financial services and childcare services. I will say there was definitely a strong theme around a need for a safety net for the middle class. There was a lot of talk of people saying they didn't meet a certain threshold, but they were still barely covering, their household expenses. So this idea of the middle class having to suffer because they don't actually fit the eligibility criteria for the safety net programs, but they're not in the higher income group where everything's okay and they can afford everything and it's not a problem. There was also definitely people wanting to extend unemployment benefits. That is currently being debated right now on Capitol Hill this week, if you're paying attention. And then also people were asking for paid family leave, more paid family leave. And this was in the context of if a member got sick or if there was a reason they had to take care of a family member. And then more small business loans. As you might recall, when these small business loans started coming out originally, I think there was a lot of confusion. And also it seemed like small businesses were probably the least likely to have access to an accountant or a person that could put their application in and get them signed up for a loan. So there was definitely some concern about having access to these programs, even when they qualified for them. And then just in general policy, people did want masks in general. There was a want for, we need to have a mask mandate. Obviously, we have that now. And then I will say there was a very even split between those who thought we should have never moved to another phase. They thought we should have stayed at home, and we should have never gone past the stay-at-home order. And then some people thought that we never should have gone into a stay-at-home order. They felt that individuals and public could follow rules themselves and they didn't need the government to tell them what to do. So I will say that was truly a 50-50 split. So if you're a policymaker, I would say I don't know if you can make a right or wrong decision based on our respondents, because they were clearly half and half in favor for shutting down essentially North Carolina and making us stay at home, and then the others wanted to reopen. Now, I know I presented a lot of information in only about 40 minutes, so I'm happy to go back to any specific slides. But I do want to ask if people have any, before I ask you this question, I would love to hear if anybody has any clarifying questions. You can either, if you put it in the chat box, or if you feel comfortable enough unmuting yourself and asking it, I can start looking at the chat box right now, and then we can go into this.
Hi, Lindsay. This is Jane McBurney, and I'm just curious, now that we've gotten this far, you know, back in March, we thought we would be done with this in 3 months, and here we are. I don't know how many months later, I stopped counting, but a long time later, and it seems like we are in a worse situation than we were before. Do you have any plans to do any follow-up with the same people? Are you in a position that you can get to them again and ask them more questions? Or what are your thoughts now as we continue in the current, you know, we're currently in the pandemic and following all kinds of guidance still. And I think a lot of us are not sure when will this end, but I'm just curious if you're able to ask information again and see how people are doing now or 6 months later.
No, that's a great question. Thank you, Jane. I will say we used this survey and we distributed, as I said, between May 5th and I believe we stopped the survey on June 12th. And one of the questions we did ask is whether or not people would be willing to do a follow-up interview. So we did have a good response rate amongst people that were willing to do a one-on-one phone interview, about an hour-long phone interview. So as part of our analysis, we actually partnered with several other states. Montana State University was actually the lead in this, and they created the questions. So we had the same survey went out to Montana residents, the same survey went out to West Virginia, to Louisiana, as well as Arkansas, and I'm trying to think of any others, and Oregon. And again, we all had written in that question of, would anybody be willing to talk about this further? So we're currently trying to find funding, because the one thing that I do think it's important that right now during this time is that we need to compensate people for their time. So if I'm taking 1 hour from somebody out of their day, I do want to compensate them for their time for talking with us. We have been trying to find funding. We'd love to see this be a multi-state study, just because we have such wide geographic representation to see how people did compare across different states and different cities. But we do hope that we can follow up with individuals, and we do have their contact information to do that. I see a couple questions of, do I have a breakdown by race, ethnicity for each of the charts? I do not yet, and that's a great question. That's one of our follow-up steps, is really to focus on how does this look based on your gender, based on your race, ethnicity, based on your household income. So that's one of our future steps, is really to start analyzing, one, based on statistical significance, and then two, how did people experience this differently? And I imagine that once we start breaking down these questions by race, ethnicity, by gender, by socioeconomic status, by zip code, I think we're really going to start seeing differences there once we're able to. Any other questions? And again, you're welcome to put it in the chat box or take yourself off mute. Okay, so while people are thinking, I want to ask this question to the group, and these are things that you can either say out loud or you can put them in the chat box. But based on some of this information or your own experiences and conversations you've had with friends or family, what are your ideas for ways that we can promote North Carolinians' food security and healthy behaviors, really in order to build a responsive public health system during and after a crisis? I think, as we've shown today, based on preliminary results, we might be dealing with a surge of people that might be food insecure in our state. And we're starting to see issues of mental health, and that's going to have to be addressed. So I would love if we have anybody that's willing to talk about this or give ideas. You can, you may not have an answer, but you are just also welcome to talk your answer out or have an idea.
Hi, Lindsay, and hello, everyone. This is Myra from the program Board My Basket. And first of all, thank you very much for all the information. And, this is a great information. What I think it will be very good to, ways to promote food security and healthy behaviors is to somehow come up with ways of prevention, because right now all we see, or at least all I see, is like, this is a virus and this is what you need to do if you get it. Okay, how do I don't get it? We're all doing social distancing, we're staying at home, but there will be a point where a lot of people will get tired of being at home and practicing social distancing. So how do we prevent, the food insecurity? I think it's great that people is interested in gardening. I think that's very good. But maybe some prevention on how to, not have that food insecurity. And as far as healthy behaviors, I don't know, again, I think some prevention so we don't get stuck while the problem gets there.
Yeah, no, I think that's a great point. Talking about, first and foremost, we should be focusing on prevention right now, recognizing that we might be able to prevent some of this, but for some other individuals, they're already starting to experience. So how do we go from prevention mode to action mode, and then trying to go back to, where were we, or can we get into an area where we're actually better before before COVID-19 even hit our state. I will say before COVID-19 hit our state, we were already top 10 in the country for food insecurity rates. So this was already a problem that we were dealing with. And I think starting at a low point and then having to work from that is just going to be that much harder. So again, I encourage us all to try to think creatively and get creatively. I'm happy, as Annie Hardison Moody mentioned at the very beginning, we'll have some follow-up webinars about what the community can do in terms of more health behaviors and what we can do that way. But again, I think that's important to raise, that this is something we need to keep on our radar and continue watching very, very closely. Other thoughts or ideas about this question? And again, I know it's a huge question, and if I could answer it, maybe I'd have a higher position, but it is definitely meant for a conversation.
I don't want to cut off any conversation, but Lindsay, it looks like you have two questions in the chat box. One is, how or when will you distribute these results so we can spread the word about these findings?
Yeah, thank Thank you, Kathy, for that question. How and when? That's a question. That's a great question. The first, of course, is this preliminary analysis. Once we start to get back into what we realize is going to be going back to school and people starting the semester, we'd love to involve students in terms of how you actually analyze results. I would hope that we could get more formal analyses completed within a couple months. I will say though, when we first distributed this survey, individuals, we really thought they were not going to respond to the open-ended questions, but some people really, a lot of people really responded to the open-ended questions. So we thought we were only going to have to deal with quantitative data, so just numbers and looking at numbers and that's it. But once we got all the results in, we realized that we were truly looking at a mixed method study because people were so willing to write, and some people wrote paragraphs of text. And I think the last question we asked on this survey was, is there anything else you'd like to add? And someone just said, thank you for allowing me to share my thoughts. I'm glad someone's asking. So I do hope that we will distribute results just like we did with the survey, which is through listservs, trying to go through community-based organizations, health departments. Obviously, we want to share this with individuals at the decision-making level, because we think this can help them go forward as well in terms of what are their next steps, or what were people feeling back in May and June, and now it's July, or literally August is around the corner. How can we plan? But I would love to have one, at least a what we call an infographic or a one-pager kind of discussing some of the results. Some people don't like to read that much, so I like to have this short one-pager, and then there's usually a very, very lengthy report that if you do like to read, maybe you would like to read, but we want to make sure that this is public data, especially because individuals that took the survey, I want them to be able to see it as well. And then also there's a question in the chat box that said, that was asking, if we are working with the governor's office and or statewide food insecurity coordinators in each county. I have not been working with anybody in the governor's office specifically about this. I have shared some preliminary findings with certain individuals and specific state offices. However, we haven't, because we haven't analyzed the data by county. We don't want to be giving out information for some reason in case in Buncombe County there's an issue that is going on, but if I send that data to someone in Orange County, they might not think it has anything to do with them. So I think this data will be much more helpful if it is centered around by county or by geographic region. But that is an important area that we do want to make sure that the state does get information from this survey.
There's another question in the chat from Amy in Indiana about how the difference between food security versus food access. So Amy says in our area, many times food is available through food pantries, state and federal programming, but the hours of availability are not always conducive for working families. Was this issue around access identified in any of the questions or responses that people gave?
Yeah, I definitely think that there were definitely issues of food access. And when we talk about access, we think about convenience. How convenient is it for you to get to the store? We think about transportation. Do you have a way to get to the store? We think about affordability. Do you have enough money to actually purchase the food you need? So what I think is, in terms of food insecurity and food access, they definitely overlap. And I will say, even though people they may have not used that term food access specifically, we were seeing a lot of access issues. And I think that will continue to be an issue just because in North Carolina, again, we tend to be generally a rural state. And also we tend to have high rates of food insecurity, and we have areas that have are economically depressed and have just structurally have not been great to everybody in the community. So this is definitely a food access issue, and then even in other terms, also a food insecurity issue. And let me know if I didn't answer that question.
I think that sort of relates to Nikki's question about, or Nikki's statement, like being interested in seeing the results broken out by rural urban spaces or by region. Food insecurity, food access looks very different in different spaces, was Nikki's point, which I think is kind of follows up with what you're saying.
Yeah. No, that is a great point. And usually we do see higher food insecurity rates in rural areas than urban areas. But in times like these, I'll be very curious to see if that flips, or does it change? Or do we find that people in urban areas are now not having the space and land to do their own gardening, or do they have an apartment and, maybe they don't have a balcony where they could try to grow something, maybe they do. But I think that's a great point. And I really do think we'll see a big difference between how people responded based on where they lived in the state. And then Dr. Dara Bloom is asking, do we plan on trying to resend the survey to get representation in the western part of the state? I think we definitely could. The one issue or concern with that is that we would be asking the same questions during a different time point. And when we were talking to people in May and June, I wonder, that's right before the numbers started to surge again. So I wonder if we get a completely different type of response from the western part of the state. I think any data is better than no data, but as long as we're able to recognize that we're comparing a totally different month, a totally different climate right now. Climate, literally, it's actually, I think the West is having a heat wave right now, just like we are here in the Triangle area. But it is a different climate, and I think people are feeling a different mood as well. And I'm hearing from Kathy that she did share the email on the survey, but we may have been able to get it out better. And Kathy is also saying she doesn't think the data would be comparable now with May and June, but yeah, we could definitely separate it out. But no, I would love others' ideas if they have ways to get these surveys out in more rural or western areas. I mean, those are the mountains, but when you can only do research over the internet, it's hard to not knock, you can't go on people's doors and ask them to fill out a survey, which is, usually in normal times, I would be doing in-person research and be working on the team on the ground and see where we go from there.
And just as we're kind of wrapping up, I wanted to point out that Andrew and Alexandra gave some, when you asked your earlier question about what can communities do or kind of what should we do now that we know this, both talking about like the real need for structural change in both the food system and kind of how we think about poverty and inequality in general. So Andrew proposed the ideas of like universal food rations, money that would be used to purchase in the local or regional food system, similar to food boxes like CFSA is doing with public support. And those things being universal to address some of the things that you talked about in the survey of people being just enough outside of the requirements for a particular food assistance program. And then Alexandra saying that this pandemic has just highlighted the existing structural and systemic problems: low wage, no worker protections, poor patchwork safety net, expensive, incomplete internet access, and the list goes on. And so I think that's a really important point to maybe close on, of that these are big structural systemic issues that we, many folks, I think probably everyone on this call, if you work in this arena, has been aware of, but they're now being kind of laid bare for so many people to see. So I don't know, Lindsey, if you have any kind of parting thoughts to leave with us.
Yeah, definitely. And I will say, I appreciate that comment. And I truly think it shows how quickly our economy can go into a state of down spiral. We have a lot of people that have worked multiple jobs for very little wages for way too long. And again, you've got safety net programs that are stitched together. And if you start unraveling that thread, it's hard to watch them all fall apart. But I think there's been a lot of policies and flexibilities that the federal government has put in place, especially when it's come to SNAP. But then again, you get into that area of what happens if people are right on the cusp where they don't qualify, but they're still struggling. Just in terms of next steps, I will say we already mentioned this, we will be examining our data closer. We do want to follow up with telephone interviews with people that said they would be interested in doing interviews. And this will be an analysis of qualitative data. So those are the open-ended responses, and then our quantitative data. And we would love to develop resources, so county fact sheets and summaries, and other ways to just share with the public. And I do want to highlight that our next 2 webinars are going to be on this upcoming Monday, August 3rd. And it'll be leveraging community organizations to support physical activity during COVID-19. And you can have a registration for that. Please register. And then the last one will be on August 10th, food security resources during COVID-19. If you have any questions or comments, feel free to reach out and contact me. And I want to thank everybody for your time on this Monday. And please continue to stay healthy and stay safe.
Thank you so much, Lindsey. And this recording will be on the Faithful Families website in probably just a few days. So we really appreciate you all joining us, and we look forward to seeing you next week.